Happy Wellness Wednesday, everyone. I'm Dr. Jordan Leasure with North Shore Proactive Health, and we are talking about my favorite topic this evening, which is poop. Um, Please remember that anything we talk about tonight is not meant to be medical advice, it's not meant to be diagnostic. It is just a topic that is very near and dear to my heart, and I feel like should be very near and dear to everyone's heart. As you can tell, I have a little bit of a scratchy throat. I've had a lot of traveling lately and a lot of speaking engagements. So I will do my best to get through this without too much coughing. I've got my pressed Vibrance, so if you're local to Libertyville, my pressed Vibrance juice, and I also have some hot tea, so we'll see what is going to get me through the next 10 minutes. Please let me know as you're signing in, if you're watching live, if you're watching the replay, if you have questions and I don't get to them tonight, I can either answer them via private message, or if we have time on air, I'll answer them because I think this is a very serious and very important topic. I'm also going to let you know why we decided to do it tonight, so let's jump right in. So those of you that have children are probably aware of the fact that we track what is coming in, what is going in, and what is coming out of a baby. So pretty much from the second that you have a child, and probably even before, doctors are making you aware of how often they should be fed, what they should be fed, and not all pediatricians are making the same recommendations. So if you are expecting or have a baby, please contact us for what foods when information sheet. But then they also are tracking what's coming out of a baby. So, hey Kim, hey Jade. So they are, every single visit that you take a baby in, they want to know how many wet diapers and they want to know how many dirty diapers. Okay, now at what point does that end? It is my belief that it should never end, that your physician should always be talking with you about bowel movements, what they should look like, what to look for, what they should not look like, and how often they should be happening. And unfortunately, this conversation is not being had. I don't know if people, hey Sandy, I don't know if people are scared to have this conversation. If your doctor is not talking to you about bowel movements, you need to be bringing it up. And if not, I'm happy to talk about it. So send me a message and we can chat about bowel movements all day long. Here's some things that you should know and what you should look for. So you should be having 2 to 3 bowel movements every single day. Let that sit in. When I first started into practice, I used to ask patients if they were regular, and I thought that was enough. And of course, someone's response was, well, yeah, I'm regular. And what was regular to them was not necessarily what was really regular. Once I was more comfortable in practice and I knew a little bit more and I knew how to talk to patients, I would ask a little bit more clearly. And I would say, well, how many bowel movements are you having? What are your bowel movements like? And come to find out, we would have some patients, and to them, normal was having like 2 bowel movements a week. Okay, that is not normal, and that's not okay. And unfortunately, it's very common because as a society, we are not getting enough vegetables, so we don't get enough fiber. We are having too much sugar, and then we are not having enough water. We're dehydrated. We're having too much pop and coffee and energy drinks. And then we're also not getting enough activity. We're too stagnant. So all of those things are going to contribute to us as a society being too constipated. And of course, constipation can lead to being crabby, can lead to being depressed, it can lead to low back pain. So a lot of different things can be signs and symptoms of simply not having regular bowel movements, which again is something that is so easy and so necessary. What to look for when you are having your bowel movements, okay? You do not want to be having, if you think of, there's a scale that we use as physicians, and it goes from, I think, 1 to 6. You don't want to be having rocks, and you don't want to be having liquid. You want to be pooping snakes, keep that in mind. And everyone you know, and you should be talking about this with your family. And it's kind of a funny topic, but really, you're responsible for your health and the health of your loved ones. So ask your partner, whether we like it or not, my husband and I talk about what his bowel movements are like. And obviously I pay attention to what's coming out of Parker's diaper. So, talk with your kids and make sure that everybody's comfortable, because I think there's even a book out there and it's for children, but I think I'm going to rewrite it for adults called Everybody Poops. because literally everybody, you know what, starting with an F word, ending with ing, poops. So it should be an issue that we can all talk about. So you want to be pooping snakes. Now, if you are pooping rocks, you're either very dehydrated, or you're not getting enough fiber, things I talked about, you're sitting too much, or if you're on the other side and you have diarrhea and essentially water, no solids are coming out, that's another problem as well. Excuse me, see, here comes a cough. I'm getting all worked up on my poop talk. Excuse me. Okay, so the other thing that you want to pay attention to is if you are on one side of that spectrum, it can be indicative of different disease processes. So if you are on the rock spectrum and you're finding that you are constipated, you're not having those 2 bowel movements a day, you're not pooping snakes, it can be indicative of a thyroid issue. Actually, either side can be indicative of a thyroid issue. So if you're hyperthyroid and there's too much action going on and the pedal's on the gas all the time, then you could be on the lighter side where you tend toward having diarrhea, or you could go back and forth between diarrhea and constipation. You could have IBS. Or if you're on the constipated side, it could be indicative of having hypothyroidism, where there's not enough energy in the system and things are slowing down. Or it could be a sign of depression. So you always want to make sure that you are paying attention to what is in the toilet. And I know, again, it's very funny, but it's a very serious topic. Also, taking a look at color. Color is very important too. So your poop can tell you a lot. That's why it's so important. If you notice that it's dark red or bright red, that can be indicative of blood. It can be indicative of old blood that's getting into the system early in the intestines, and that would make it a darker, like a deeper brown red. Or if there's bright red, it can be indicative of something as a non-emergency issue like hemorrhoids, where you're bleeding a little bit right before it comes out. It could be indicative of something like cancer. So make sure you're paying attention to what is going on in your poop. And again, this is not meant to scare anyone, but it's meant to educate you and be aware of what's happening. If your poop is green, it can be indicative, and maybe you're not digesting, so you're having pieces of food in your poop. What other colors do we have? That you could see fat in your poop, and that's indicative of how your organs are working. So that's why poop is so important. It tells us a lot about what is going on and what's not going on. So always pay attention. Excuse me. I have friends that are so serious about it, they don't let their kids flush. So they check and they see what's going on before they flush. And luckily for Parker, I don't have to do that yet, but we'll see. It may come to that. What else can I tell you about poop? You want to make sure you're doing it. Make sure you're pooping snakes. Make sure you're paying attention to color. And it should be easy, okay? It should not have stress or strain. I know some offices that I've been at and some people's houses, they're using the squatty potty so that your knees are up and you're in a more natural pooping position, and that may help you. So check that out. I think they sell them like on Amazon, and really it doesn't take a brain surgeon. I mean, put some books in the bathroom and prop your feet up on the books and you get the same idea. So there's lots of ways to go about making sure that you're having normal, natural, regular bowel movements. What else can I tell you? Those are kind of the highlights. When to do it, what to look for. And then I wanted to let everybody know, why we were doing this topic tonight. And I apologize. I meant to have this email pulled up and then I forgot. But I did this, and we're talking about this tonight. And I know poop is funny, but we're going to get serious here for a minute. I have a close friend, and she actually lost her grandmother recently. And the reason that she passed away, I don't have the exact diagnosis, but here's a little email that she sent me. So she said, apparently she was sick for over a year. At one point, she didn't poop or pass gas for over 30 days. Let that sit in. That is a long, long time. The physician said that she looked 9 months pregnant. Her stomach was super hard to the touch. They had tried all laxatives, enemas, but the doctors kept saying not to worry. I'm telling you, if you don't poop for like 3 days, you need to be calling my office, or you need to be calling your physician, because getting adjusted can help you make sure that you're having regular bowel movements. We see a lot of kids for it, but we actually could be seeing adults for it as well. So keep that in mind. Magnesium is also terrific. If you're having issues pooping and you are making sure that you are not having any other disease processes going on, that you're hydrated, that you're active, and you're eating your fruits and vegetables, magnesium is something I recommend to my patients to take before bed. And then let's finish this up before I give my last recommendations. So her stomach was super hard to the touch. They tried laxatives, enemas, and the doctor said not to worry. They tried a colonoscopy, but they couldn't complete it because she was so backed up. They removed 9 feet of her colon, and they reattached it directly to her intestines. Even that didn't help. She continued to not be able to pass gas or have a bowel movement. She quickly went to the ICU, and they pulled the plug on her last Friday. So this gets me choked up, because literally, like, having bowel movements are something that we have to do, that we should be doing, that is so important for you and your family. And again, I mean, it's a funny topic, but you should be able to talk about it with everybody involved. My last bit of advice, and this is from Dr. Terry Walls. She's amazing. If you don't know who she is, Google her, follow her. But she recommends having 9 servings of vegetables a day and breaking it into 3 servings of sulfur-containing vegetables, 3 servings of green vegetables, and 3 servings of colored vegetables. And if you do that, then you should be having regular bowel movements. It shouldn't be a problem. And you will also be getting a variety of different nutrients that will help your brain work better. It will improve the quality of your skin. It will improve your energy levels, and obviously help you to continue to get rid of all of your waste. And that's part of the reason that pooping is so important, because you want to make sure that your detoxification processes are happening as they should, and the toxins are getting out of your cells, but then you have to get those cells out of the body. And pooping is the easiest way to do that. So please make sure that you're doing that. If you're not, send me a message. I put a link in the video for a free lifestyle journal. Feel free to sign up, download that, and use it. Have your family use it. If you are in charge of your parents, so if you are helping elderly individuals, they can be doing it too. And then check every week that everyone is having bowel movements, that they're getting in their fruits and vegetables, that they're getting in their activity, that they're doing their gratitude journal. All these little things that we can do every day to make sure that we are happier and healthier and living the life that we deserve to. So again, I'm Dr. Jordan Leasure with North Shore Proactive Health and Salutogenic Life. If there's questions, if there's a topic that you'd like to know more about, please let me know. I would love to help. If you have questions about bowel movements and you don't know who to turn to, I'm your woman. And that's about it. So I hope you have a wonderful evening. I know that it was a funny topic. I hope that you learned something, and we will hear from you soon. Have a great evening. Bye-bye.